Hello, I'm Dr. Adnan. Today we will take a journey through the differential diagnosis of chest pain. In addition to day-to-day practice and OSCE, it will be helpful in a number of other ways. There are numerous causes of chest pain, but I'll concentrate on some of the most significant ones. Let's start with the history taking. Elaborate the chest pain first. We can remember with the mnemonic Socrates. S for sight, O for onset, whether it's sudden or gradual in onset, whether it presents all the time or comes and go. C for character, R for radiation, A for associated symptoms, T for time course, E for exacerbating and relieving factors, S for severity or scoring from grade 1 to 10. After elaboration, inquire about associated symptoms. Based on elaboration, suspect few differentials and ask associated symptoms of it. Now past medical history. We will ask for history of similar conditions. Diagnosed with any medical conditions. Taking any medications including over-the-counter medication, any supplements or herbal medication. Allergic to any medications. History of hospitalization and previous surgery. History of any family diseases. Coming to the personal history. Elaborate diet, smoking, alcohol, physical activity, stress, recreational drugs, sexual history. Ask for TOL. T for travel, O for occupation, L for living condition including housing and with whom he or she is living. Plus, ask about driving, whether he or she drives any vehicle or not. In female, ask for 4 Ps. P for pregnancy, we will ask for current or any previous pregnancy. P for pills, means we will ask for any contraceptive use. P for periods. P for pap smear. Asking every question would be unnecessary in history taking, instead only pertinent ones should be asked. Let's move to the differential diagnosis of chest pain. From the inside out we can recall causes easily. From within, we can begin. First is heart. We will gradually advance outside towards lungs, GI tract, musculoskeletal including costal cartilage, skin. We can start with the most precious organ of our body, heart. Causes of chest pain related to the heart are acute coronary syndrome, including STEMI, NSDMI and angina, pericarditis, infective endocarditis. Causes related to lungs are pneumonia, pulmonary embolism, pneumothorax caused by trauma or some underlying conditions, like asthma, malignancy, tuberculosis. Causes related to gastrointestinal tract are gastroesophageal reflux disease, esophagitis. Musculoskeletal related causes are costochondritis, musculoskeletal pain, and herpes zoster. Let's now address a few important pathologies and the crucial questions we must ask. Starting with the acute coronary syndrome. STEMI is a critical medical emergency that occurs when an embolus unexpectedly blocks the flow of blood to the heart. The infarction is there. NSTEMI, or unstable angina, is caused by the development of a thrombus in one of the coronary arteries, which ultimately compromises the blood supply to the heart. The ischemia is that. Symptoms of acute coronary syndrome are chest pain, a feeling of pressure, heaviness, tightness or squeezing across the chest. Pain is radiating to the left arm, jaw, neck, and back. Feeling lightheaded or dizzy. Sweating. Shortness of breath. nausea, vomiting, anxiety. Sometimes chest pain presents similar to features of indigestion. Afterwards, pericarditis. In pericarditis, pericardium gets inflamed, and blood or fluid can leak into it. It's difficult to confirm the exact cause of pericarditis, however it's usually a viral infection. Symptoms of pericarditis are chest pain, which is sharp or pleuritic in nature, behind the sternum, gets worse on a deep breath and in a lying down position. Also it can present with fever, shivering. It often follows a viral infection, such as a sore throat and common cold. It can occur within 48 hours after myocardial infarction. Moving to the pulmonary embolism. Pulmonary embolism occurs when a blood clot gets stuck in an artery in the lung, blocking blood flow to part of the lung. It is commonly associated with deep venous thrombosis, in which blood clots from the legs travel up through the right side of the heart and into the lungs. Symptoms are chest pain, which is sharp in nature and at the upper back area. Shortness of breath. Hemoptysis can be there, which is one of the criteria for a Wells score. Palpitations, associated with deep venous thrombosis. Symptoms of deep venous thrombosis are pain, redness and swelling in one of the calves. Most common risk factor for deep venous thrombosis is prolonged immobilization. Let's discuss pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus. Symptoms of pneumonia includes chest pain, which gets worse on breathing or coughing. Cough can be dry or productive, thick yellow, green or brown in color. Phlegm can be blood-stained as well. Shortness of breath. Palpitations. Fever, feeling unwell, sweating and shivering. Loss of appetite. Let's move to the next one. Costochondritis. Costochondritis is inflammation where our ribs join the sternum, in the middle of our chest by primary cartilaginous joints. Symptoms are sharp chest pain in the front or side of the chest. Pain may be worsened by pressing middle of the chest. Breathing deeply. Upper body movement. It is caused by injury to the chest. Repetitive upper body movements, like lifting. Chronic cough. Let's discuss herpes zoster. Herpes zoster, also known as shingles, is caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox. The first signs of herpes zoster are tingling, painful or burning feeling in an area of the skin, headache or feeling generally unwell. Then, rashes appears. Initially it is painful, blotchy on one side of body only, which then becomes itchy blisters that oozes fluid. In the last, it dries out and turns into scab. Other symptoms are chest pain, fever. In the last, coming to the red flags. Chest pain that spreads to the arms, back, neck or jaw. Chest feels tight or heavy. Pain started with shortness of breath, sweating, nausea and vomiting. High-grade fever. Drowsiness or confusion. Hemoptysis. Pain, redness, and swelling in the calf muscles. Thanks for watching. Like and share. Don't forget to press the bell icon. Follow us on Instagram.